we need the government to intervene immediately. Like, it's not going to collapse. It has collapsed. It is bad.
Hey, welcome to News You Can Use. I'm your host, BG. Listen to this. Nurses across Ontario are feeling disrespected. That's a sentiment we continue to hear from these healthcare workers that have been on the front lines during this pandemic. In fact, one nurse has taken to social media to voice the frustrations of nurses that have been brewing for quite some time now. Now, before we get into all of those details, I do need to do a few things like subscribing to this channel, tapping that notification bell, and make sure to follow us on all of our social media. The details are in the description below. So I want to introduce you to Birgit Tamagwa. She's a registered nurse in Ontario who has some strong opinions on healthcare in this province. She says the healthcare system has collapsed and that a lot of people who actually work in healthcare, like nurses and PSWs, don't feel that the government is doing enough to support them. She's actually here today to give us the inside scoop on how healthcare professionals are feeling at this point in the pandemic. Let's bring her in. Thank you so much for joining us here on News You Can Use.
Thank you for having me.
I'm glad you're here because, we're living in a time where a lot of people are looking at the circumstances of healthcare workers, nurses in particular, and saying the conditions that nurses are going through right now are not okay. And I know you've been very vocal on social media talking about those conditions. Can you give us a bit of an inside look into what's happening with the profession right now?
I have so much to say.
Well, you got the floor here.
It's very challenging
Yeah.
to be a nurse right now. We have a lot of nurses that are, been working through the pandemic.
Yeah.
A few of my colleagues have been recently diagnosed of PTSD,
Oh, wow.
depression, anxiety. The working conditions are so bad, so people go to work not knowing what to expect, working 16 hours a day, without breaks, I'm telling you, without pee breaks.
Wow.
Well, we do have, time to just dash off to the break room to eat our food, and that's about it. You're not really well rested. So it's very challenging. We're always working short staff. A lot of nurses have quit.
Yeah.
It's been very stressful working. Some people took early retirement. Some people left for the States. They're more competitive, more incentives over there. And also because of Bill 124, I'm sure you've heard this a lot, which is a wage suppression legislation that was implemented by the Ford government to cap our wages at 1% increase a year, which is well below inflation rate. And not being able to bargain our pay when we're doing 4 times the work is an insult. It's a slap in the face. So people are just done. People are leaving.
I want to talk about the burnout that I've been hearing from so many nurses and how real this burnout is. Because at the start of this pandemic, it was a rallying cry around healthcare workers. I remember there were people in their apartment buildings, on their balconies, neighborhoods. They were chanting, they were tapping their pots and pans for healthcare workers. There seemed to be so much support from the public, but on the inside, were you guys actually feeling that?
It's great to have support from the public. It's great to have people who understand our realities, but the kind of support that we really want as support in form of policy that would change the working conditions to be better for nurses, which is a female-dominated profession, really. A lot of nurses are women. I've had to reduce my work hours because it's just hard wearing an N95 mask for 16 hours, 12 hours a day. In addition to that, we have other protective equipment we have to gear up on, and sometimes we're wearing those in suffocating environments and doing chest compressions on patients.
We hear Premier Doug Ford at his press conferences and even the Health Minister, Christine Elliott, talk about how much they applaud, our nurses and our healthcare workers. But do you think this government actually supports nurses in particular?
Oh no, I really do think Premier Ford doesn't support nurses. We've had to go on rallies, Queen's Park, multiple times last year, and under the rain, and where we heard, absolutely not. Well,
and you guys are just asking for proper pay level increases, because right now it's capped at what percentage?
1% increase a year. So we have nurses.
That's below inflation, and we're seeing record level inflation right now.
Yes. yes, the price of food has increased, like
Not just
paying
food,
rent,
but rent.
accommodation, like
Yeah.
anything. So we can't even bargain our pay. So you're seeing nurses who've given 35 years, 40 years of their lives to nursing, and they're capped at $48 an hour.
But can I ask you a question? Because I've also been reading in my research that because of the nursing shortage that's been experienced, that the government has been trying to get in temp nurses into the profession. And I've been hearing that the wage that they're offering new people coming into the profession sometimes is higher than people who've been in the profession for more than a decade right now. Is that true?
So the thing with that is there have been recruitment incentives. I think sometime last year there was
Yeah.
up to like $15,000-$20,000 for nurses to be recruited to work in certain areas as well.
Right.
And so yes, that was also an insult, because imagine working and doing your best and you're not being incentivized, and then people just deciding to transition from one area to another, and they've been incentivized. So we have staff nurses quitting to join temporary agencies because the pay is more competitive.
Do you think that we could see a collapse of our healthcare system if the government doesn't act?
Oh, it has collapsed.
Oh.
I don't know why people keep saying it is collapsing. It has collapsed. I'm talking about, like, you don't understand, working in an ICU with 9 nurses.
Yeah.
Patients' lives are impacted.
Because how many should be in there?
22. So these are people on life support machines,
Yeah.
on multiple medications. Anything could go wrong anytime. So things are happening that are impacting patient care that we can't really talk about.
Is there anything that you want the public to know that needs to be talked about more, or is there any other perspective you want to share?
So yes, we do have a pool of internationally educated nurses right now in Canada. Internationally educated nurses, they're already licensed to work. They've been accredited by the College of Nurses. They're ready to work, but they don't have the permanent residency.
Okay.
So we need immigration to work on that, so these people can come and help.
Okay.
And then we have another pool of internationally educated nurses that need to transition to working as nurses. So we need those people to be, supported.
And this could help with the staffing shortage?
Absolutely, absolutely.
Okay. Can I ask you a question? If the camera right there was the premier or the health minister, what would you say to the premier if you could say something directly to him right now?
Please repeal Bill 124, because nurses are quitting as a result, and the working conditions are getting worse, and more people will quit. So experienced nurses are gone. And the younger nurses absolutely have no support.
Thank you so much for shedding your light on this circumstance, and honestly, all the flowers to you and all the nurses who have worked and continue to work tirelessly throughout this pandemic.
Well, thank you very much for listening. I hope things change. I really do.
Hey BG Squad, thanks so much for checking out our channel, and listen to this, we have more great content for you, like this video right here and this video right here. By the way, don't forget to subscribe to this channel right now and tap that notification bell.